We're not going to talk about every infectious disease out there. That would take a long time. But we're just going to talk about some select infectious diseases, just for fun. Ones that we commonly see. So, C. difficile, or C. diff, is one that you commonly see in a hospital or inpatient setting. It causes diarrhea and colitis. It's the mostly seen in immunodeficient or immunosuppressed patients on antibiotics. So it disrupts your normal gut bacteria balance and it causes the severe diarrhea, abdominal pain, fever, and it can lead to dehydration and electrolyte imbalance. And electrolyte imbalances can kill you. So it most commonly happens in hospital or residential facility, spreading from unwashed hands. That's the most common thing. Or contaminated objects and equipment. So sterilize your equipment and wash your hands. It's treated with antibiotics, pretty serious antibiotics, and sometimes people have to have a fecal transplantation, which um, yikes. And that just replaces the normal flora that you lose when you have C. diff. It can be a really difficult infection to fight, and hand hygiene is the most important way to stop the transmission. So MRSA stands for methicillin-resistant Staphylococcus aureus. So Staphylococcus aureus is part of our normal flora in our upper respiratory system, and the methicillin-resistant version is resistant to commonly used antibiotics. So um, Staphylococcus aureus is present in the nose and skin of most people. And it can be problematic with open wounds or systemic infection because it's an opportunistic pathogen. Um, Hospital-associated MRSA and community-associated MRSA are very common. So MRSA is out there in the community. So if you get the infection, it's going to be really hard to fight. They have to use serious IV antibiotics to fight it. So it's usually transmitted by skin to skin contact, so shaking hands with someone, hospital equipment, athletic facilities like shared towels and equipment, or shared needles for injected drug use. Don't do that. I know I don't have to tell you that. So the symptoms can be skin infections like boils or abscesses. It can turn into the flesh-eating virus, Staphylococcus aureus. Um, and it can be, you get red, swollen, painful, pus-filled lesions, fever, and can progress to pneumonia or septicemia if it gets in your blood. Not good. Hand hygiene, PPE use, don't share stuff, and cover wounds until they're evaluated. If somebody has been diagnosed with MRSA, they have to get retested pretty often to know that it's gone. There are limited antibiotic options, but there are a few of them listed there, and it's usually IV antibiotics and can be fatal if untreated. So MRSA is really serious. Lyme disease is a bacterial infection, and it's insect vector, deer ticks. Primarily the northeastern United States has bacteria infected deer ticks. And there's been a trend of cases steadily increasing over the past 25 years. And Lyme disease has sort of early symptoms, like in the first month. It's usually transmitted by a tick bite, usually, and ticks have different stages of life, and usually it's the nymphal ticks. They're very small and often go unnoticed. They're not the adult ones. So in the first 3 to 30 days, fevers, chills, headache, so that sounds like the flu, right? Similar to flu, but it lasts longer, and swollen lymph nodes. Then you get this rash, this bullseye rash, and there's a picture of it right there. It's usually painless, but it might feel warm. So that rash is in 70 to 80% of cases. And then they're thinking, oh, wait a minute, maybe it's not the flu, maybe it's something else. In later symptoms, days to months after the tick bite, people can develop severe headaches and neck stiffness, um, rashes in other places besides on the bite, arthritis, especially in the knees, facial palsy, where one side of your face muscles don't work because it affects the cranial nerves, heart palpitations, which is called Lyme carditis, neurological symptoms, and memory problems. So, early treatment, and there's antibiotics that treat it, early treatment leads to better outcomes. You don't want to get to the point where you get this stuff. It's diagnosed with, there's a two-step blood test. They go by clinical signs and symptoms and history of tick exposure. Um, in the early stage, they give you oral antibiotics. If it's developed into neurological or cardiac symptoms, then they go to IV antibiotics. And there is a post-treatment Lyme disease syndrome, PTLDS, which can have long-term effects. So watch out for ticks, especially if you're in the Northeast. Common viral infections, respiratory rhinoviruses, common cold, influenza, RSV, systemic. These are the ones we looked at in the last slide. So lots of common viral infections. Respiratory syncytial which is RSV, cold-like symptoms. There's a 1 to 2 week recovery. Usually, very young infants or the elderly or immunocompromised are in the high-risk group. Babies can develop bronchitis, and older adults develop respiratory illness. Usually, it's treated with symptomatic care, hospitalization for severe cases, but there is a vaccine for it, so it's preventative. Um, with the measles, it's highly contagious. This people always say, like anti-vax people, they say that they're going to depend on herd immunity to protect their kids or whatever. 90% of unvaccinated exposed individuals become infected. There's no herd immunity protecting you there. So get your MMR vaccine. It's transmitted by airborne droplets. People sneeze, talk, breathe, and there are those droplets just waiting to make you sick. The virus is active in the air or on surfaces for hours, hours. So the regular symptoms, cough, runny nose, red eyes, fever, and the characteristic rash, they have these white spots in the mouth that are called Koplik spots that are diagnostic for measles. Um, you can also have complications of ear infections, diarrhea, pneumonia. That's what usually kills you with measles, and encephalitis, which causes hearing loss, brain damage, and death. High risk groups are children under 5, elderly people, pregnant women, and immunocompromised individuals. So the MMR, get it, just get it. So in 2000, the CDC said we've eliminated measles, but now there's a resurgent due to vaccine hesitancy and travel, getting it from other places. So just get vaccinated. Um, Mumps, it's rare in the US if you get MMR vaccination. It's transmitted by direct contact with saliva, which is also respiratory droplets, and if you sneeze on stuff, contaminated objects, fever, headache, malaise, swelling of parotid and salivary glands. That's the mumpy part. Sore throat and painful swallowing. Complications of mumps are serious: meningitis, encephalitis, hearing loss, and organ inflammation. So, not a fun thing. In the olden days, we just got the mumps. It's less dangerous when you get it as a child. If you get it as an adult, it's far more dangerous. Hand, foot, and mouth disease, it's an enterovirus. It's primarily affects children under 5, and it's transmitted by airborne particles, close personal contact, poor hand hygiene, contaminated surfaces, and the typical symptoms of viral infection. And then characteristic rashes on hands and feet, in the mouth and throat, and possible nail loss. Interesting, right? COVID-19, it's SARS-CoV-2, which is coronavirus disease 2019. We all know about the pandemic. It's transmitted by aerosol particles and airborne droplets, so it can travel far. Talking, coughing, sneezing, singing, highly contagious 3 days before you become symptomatic, and infectious up to 10 to 20 days after symptom onset. The first version of COVID that came out was extremely deadly. Now the newer versions are less deadly, but get vaccinated. That's my message. Um, Variable presentation. There are asymptomatic carriers. You can be transmitting disease even if you're asymptomatic. It can be anything from mild cold and flu-like symptoms to severe illness requiring hospitalization or death. So common symptoms are fever, cough, shortness of breath, sore throat, headaches, loss of taste and smell, fatigue, and body aches. Long COVID is symptoms that last longer than 12 weeks, and fatigue is the most common one of those. Lots of different fungal infections, ringworm, direct contact. So if you wear those slip-on shower shoes when you shower at the gym, um, yeast infections, histoplasmosis from bat and bird droppings. Don't clean out old barns in Ohio and Mississippi. Parasitic infections, Giardia, you get from drinking contaminated water. Malaria, you get from mosquitoes, infected mosquitoes, and ectoparasites are transmitted in close quarters and visible to the naked eye. So lots of fun infections. Don't get them. Use good hygiene practices.